In today's video, we are going to talk about the different roles that nurses fill in rheumatology and how a nurse can work in rheumatology. Hi, I'm Dee, a rheumatology nurse and patient who does weekly videos, so if those sound something that would be interesting to you, be sure to subscribe to my channel and hit the bell so that way you don't miss notifications. So we're going to break this video down today between the three different types of settings that nurses can work in within the rheumatology realm: the office setting, the clinic setting, and an infusion center setting. So we're going to start out with the office setting. A lot of times in the office setting, nurses spend a lot of time on the phone and on the computer doing triage. So there's usually some sort of nursing line or triage line that patients or family members can call for the rheumatology office to ask for advice, or if they have a problem or if they have an update to give the provider. A lot of times they do that by calling the nursing line, and that is what those office nurses typically end up doing. They will go and triage to determine if it is an issue that they can solve by themselves without having to contact the provider, or if it is an issue that needs to be forwarded to the provider. And then they also will prioritize whether or not it's an emergent situation, like they have to let the provider know immediately, or if it's one of those things that they can put that message in the doctor's inbox and they can just check it throughout the day. So in addition to triage, what some nurses also do in the office is handle prior authorizations. You might know it as pre-certification or predetermination or prior approval. They all mean the same thing. But essentially what it is when you need your insurance company to approve paying for some sort of procedure, some sort of lab. A lot of times it's for a medication. That is what prevents the families from getting a huge 100% it's your responsibility type of bill, and no one likes that. I also be a prior authorization specialist that isn't necessarily a nurse, but in some clinic and office settings it will be the nurse that goes and gets the prior authorization. Some other jobs that nurses might have to do in the office also could be going through and setting up refills for the providers to sign, relaying messages to the provider if there's some sort of update for a family or update from insurance. If a prior authorization got denied, which does happen more than I wish it did, then a lot of times the nurse will get that information together so that way the provider can go and make the necessary steps if they need to go and appeal to the insurance company. If patients and families call the nursing line when they really needed to talk with the secretaries, we will transfer them over. Or if other offices call us needing information, or if they have an update for us, a lot of times the nurses will handle that as well. So the next setting that nurses could work in is going to be the clinic setting. And this is also going to vary depending on the clinic and how it runs. Some clinics will have the nurses function more like care coordinators or case management workers, where they will go and connect families to different resources to help them get the treatments that they need and help them be able to afford the care that they are getting, because specialty care in general ain't cheap. Some of the medications, if insurance doesn't cover it, thousands of dollars a dose. Some nurses also do more of a rooming type of role, where similar to how a medical assistant will bring you back and get your vital signs and ask all those questions. Some clinics will have nurses do that as well. And then nurses also do teachings, specifically RNs. In my opinion, LPNs are more than capable of teaching. It's a technicality that they can't teach. So this is more of a registered nurse kind of role. Those kinds of medications that don't require you to go to an infusion center but aren't pills, nurses will teach patients and families how to give themselves those at home, how to store the medication, what to do if a dose is missed, what to do if they feel like they didn't give themselves all the medication, and how to store all of the needle type things. It depends on the employer as far as what your duties would be for the clinic setting. And the last setting that I have here is the infusion centers or infusion clinics. Some medications have to be given in an infusion type setting, similar to how cancer patients get chemotherapy. It really also depends on the employer. There are some infusion centers that solely focus on rheumatology and rheumatology medications, and that's all that you handle if you were an infusion nurse. There are some employers that the infusion center will only handle chemotherapy cancer patient medications. And then there are some employers where the infusion centers is a mixture of both, and you have to be prepared to do any and every one. This setting is going to be the closest you can get to what it would be like if you guys have been working in the bedside in the hospital setting and you're giving medications through the IV and you're monitoring them to make sure the IV side is okay. You're making sure that they're not having any allergic reactions, and if they are, you work fast to make that stop. Explaining a little more about the medication that they're getting. A lot of times, even though the doctors may explain the medications and the office and the clinic nurses may also explain a little bit, that repetition comes full force, and many times they will go and ask you. The typical working schedule, it doesn't matter if you are in the office, clinic, or the infusion setting, typically will be Monday through Friday. Some employers might have some limited Saturday hours, standard business hours. Now the infusion clinic might have a couple of extended hours to accommodate patients who go and work a 9-to-5 job. That's very employer specific though. Now, to be able to work as a nurse in rheumatology, nursing experience and an active license is all you need. You do not have to be a certified rheumatology nurse. As a new grad, you have a huge learning curve right there. As a rheumatology nurse, you have a different learning curve, and if you add that to the new grad learning curve, I mean, it's a lot of stuff to learn, and you're learning it all on the job. They don't have time to teach you how to be a nurse. They don't have the time, and they don't have the budget because they're way more limited than the hospital floors. Though, if you're interested in pursuing a rheumatology nurse certification, I'll just leave a link down below going over the new guidelines on how to get it. I think that just about wraps up this video. I hope you guys were able to find this information useful. If you found this helpful for someone else, be sure to share this video. Leave a comment, subscribe. The more interactions that I get on my videos, the more that YouTube will go and spread this information to other people so they can see. So I will see you guys in the next video. Okay, bye.